Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. You can also visit the playlist, and in the playlist I have provided almost all the topics in a very systematic order. You can make use of it. Thank you very much. Friends, since so many classes we have been discussing nephrotic syndrome, the contemporary part, and today onwards we will go to discuss the Ayurvedic understanding and as well as Ayurvedic management of nephrotic syndrome. How best we can offer our Ayurvedic treatment for a child with the nephrotic syndrome and how much benefit we can offer. That part we will discuss in the coming classes. Now, we know that there is high prevalence of this minimal change nephrotic syndrome or idiopathic nephrotic syndrome in childhood practice, and we also know that the incidence of such incidents are high with those kids who had suffered with repeated respiratory tract infections, throat infection, pharyngitis, laryngitis, tonsillitis, etc. That means recurrent throat infections by means of streptococcal group of infections always increase the risk of developing the nephrotic syndrome. Not only nephrotic syndrome, many of the other autoimmune disorders, the risk increases with the repeated respiratory tract infections, especially by streptococcal bacteria. Now, as far as the contemporary science says that there is no exact cause is identified, no exact cause, therefore it is called as idiopathic. No exact cause has been identified for minimal change nephrotic syndrome, hence it is referred as idiopathic. Although they attribute some sort of exaggerated immune response as a major cause and put it under the heading of autoimmunity, but still exact cause why it happens they don't know. Why that particular immune exaggeration takes place, that immune exaggeration going to cause damage to the glomerular membrane, that part they don't know. But we know that glomerular basement membrane, it contains some of the collagen tissue, I think collagen tissue type 4, which is more prone to develop immunological injury like any of types of autoimmunity. But why exactly it happens, why immune system actually over exaggerate, so these issues are not still clear now. Anyway, no exact cause is identified till date for minimal change nephrotic syndrome, hence it is referred as a idiopathic. But most of the studies and also the clinical experience and the use of the steroids and response for the steroids and other immunosuppressive drugs to the nephrotic syndrome, so that gives a clue regarding immunological base. As immune mediated response, which is of exaggerated type, is causing the damage to the glomerular membrane. Hence, it should be considered under the autoimmune disorders. This is what majority of the people say. But there is no any specific immunoglobulin depositions was found in the glomerulus. Although this is attributed, but we cannot find any specific immunoglobulin depositions, etc. over the glomerulus. Definite role of T cell mediated immunological response with the abnormal secretion of lymphocytes by the T cells is thought to modify the glomerular basement membrane. B cells are also involved during the relapse. So why I have given this one slide regarding this immunology is we can attribute the immunity as the major causative factor here for this nephrotic syndrome. I mean to say, immunity is of three types. One is immune suppression, decreased immunity. We call it as immunodeficiency. Another one is exaggerated immunity. Another one is deranged immunity. Okay. Now, decreased immunity, that is basically a diet factor and also our lifestyle factor counts. Whereas in exaggerated immunity, it is not related to the deficiency symptoms. Nutritional deficiency will not be there, but our body immune system behaves in a hyper excited way. Okay, it produces its own antibodies against our own body tissues and cause the damage, and as a result there is a inflammation takes place, and this inflammation is called as non-infective inflammation. It's not infective inflammation, non-infective inflammation. Another type of the immunity is a deranged immunity. Deranged immunity is usually seen in case of malignancy, etc. conditions. Anyway, so all the explanations which are explained suggest you of a definite involvement of the immune system. There is immune system involvement is there. Of course, it is hyperexcited in the pathogenesis of the minimal change nephrotic syndrome. Now, when we talk about immunity in the Ayurveda, there are two things are considered. One is Ojas and another one is Kapha. Okay, Kapha is present in each and every cell of the body. That is one set of immunity, first line of immunity, and second one is ojas, which is considered as a generalized immunity, which is present all over the body. As the immune suppression results in excellent recovery in the nephrotic syndrome, we know that as per the knowledge of the contemporary science, immune suppression results in excellent recovery of the symptoms. An exaggerated immune response has been predicted. So that means when you control that exaggerated immune response, the symptoms come down, and although the disease also get recovered. This is nothing but autoimmunity. So this can be well compared with the two concepts. One is concept of aberration of the ojas. Okay, aberration of the ojas in terms of Ayurveda. Now in ojas we have got three parts. One is ojo kshaya, ojo visramsa, and ojo vyapat. Okay, although all the three are the immunity related disorders, ojo kshaya is basically, you can say, deficiency of the immunity. Okay, immune deficiency because of nutritional causes and some other causes. Whereas ojo visramsa is not because of the deficiency factor, it has got its own causative factors. Okay, so it may be an exaggerated type of immunity. Even the ojo vyapat, that is also a outcome of the immunocompromised state. So therefore we have to consider, just like in the contemporary science we say the immunodeficiency, hyperimmunity or autoimmunity, and deranged immunity. So we do have the ojo kshaya, ojo vyapat, ojo visramsa, and ojo vyapat. Now, involvement of the kapha as a vitiating factor. Another important factor which maintains immunity in our body is kapha. So body is made up of three important vital forces. We know that vata, pitta, kapha, and kapha always take care of the body immune system. Stiratva, stairya, stiratva. So that is the function of the kapha. So one will give the stability. So it is also called as bala. It is also called as avalambanakara. So therefore, we know that balyavastha is actually the stage of kapha dominant, and in the meantime, functionally, this kapha is not completely developed, underdeveloped, and it is in the process of development. That means immune system in a newborn child or in the pediatric age group is more functional because child is exposed to more and more infections. Therefore, immune system is more active and alert, but it is functionally not complete. Functionally and as well as structurally, it is not complete. It is on the way of development. So therefore, a growing baby will have a lot of infections. Okay, so the same has been told in Ayurveda, that is balyavastha is predominantly kapha avastha, and kapha disorders are quite common in this condition. Okay, so instability of the kapha leads to certain fluctuations in the immune system, and functions of the kapha and apara ojas are almost all similar. We know that para and apara ojas, if you look into stira upachita vamsatva, like that, the symptoms of apara ojas and symptoms of kapha, that means functions of apara ojas and functions of kapha, almost all they are similar. Hence they got direct influence over the ojas. So we can conclude that when we talk about immunity in Ayurveda, so two things we have to consider. One is kapha and another one is ojas. In the ojas, again, we have to look into ojo kshaya, vyapat, and as well as visramsa, just like hypoimmunity, hyperimmunity, and as well as deranged immunity. Okay, now we shall see the minimum change nephrotic syndrome versus ojo vyapat. How we can correlate the minimal change nephrotic syndrome with the ojo vyapat or kaphaja rogas. So that we will see in the next class. Thank you very much.